Hopefully, and this should be a relatively short agenda, so hopefully we can get through it quite quickly. Just a bit of housekeeping side of things. Do apologise for the slight delay this morning starting. That we've got a few technical issues with our chamber, which we're having to try and iron out. So do bear with us as we try to get adjusted to this. And I'd like to give my apologies once again to the board for not being able to attend in person today. It was a bit of a little bit of a nightmare of what happened, so I do give my apologies. I'm not there with you today in person. I'd like to remind members, as I say, we are recording this meeting just so as a result of what's gone on today. This meeting will be recorded and subsequently posted online for people to view. I've received apologies from absence from Jeff Banks, but Claire, have we received any other apologies for absence?
Yes, we've got Councillor Johnson, Councillor Shinnick. Michelle is stepping in for Sheila Murphy, Michael Deneen, Alexandra McCann that is being represented by Margaret Allen. We've got Fiona Ryan, Kim James and Jill Burns.
Yeah, thank you, and all those are noted. I'll just move on to item 2 with the minutes from the last meeting. I understand Margaret has got some action points from the previous meeting. I was going to take the feeling of would you prefer to update the board right now, or would you like to wait until the next meeting of the full meeting?
Yes, for the full meeting, if that's all right, Councillor.
That's not a problem at all. So if we move to what we'll do is we'll move to approve the minutes, and then we'll follow up and take these action logs forward to the next meeting. Are those in person happy to approve?
Approved.
Thank you very much. I've received no items of urgent business, so I'd like to see if is there any declaration of interest from any members? Oh, no. Then I'll move on to item 5, which is the end of year report for the Better Care Fund. I'd like to hand over to Christopher Smith, who runs through the report and outlines what's happening to the board.
Thank you, Chair. As you say, this is a report on the Better Care Fund plan for 2023 to 2025. It's a 2-year plan, unusually. Just to summarise, the Better Care Fund is a collection of budgets which are pooled under the joint oversight of the NHS and councils at a local level. We've been undertaking the Better Care Fund since 2015, and we've seen some changes along the way, one of which I'll remark on in a bit more detail. The focus of the fund has been on the care of people who are age 65 and over, and particularly those who are most at risk of admission to hospital or residential care home. The plan is, as I suggested, usually undertaken on an annual basis. This year we have to produce a 2-year plan, although there will be a need to refresh that because the budget or the allocations for funding for 24-25 have not yet been confirmed, but nonetheless we're presenting you with a 2-year plan. And this is something we've developed with system partners over the last few months, following the guidance which was issued in April. Now, the plan has been already submitted to NHS England. Part of the requirements was to receive a plan by the 28th of June, beg your pardon, 26th of June, and the requirement is that plan is approved both by the council and the Integrated Care Board, and then it is signed off by the Health and Wellbeing Board, which is why it's coming to you today. It couldn't come earlier because we didn't have a meeting that was scheduled within the deadline. Just to talk a little bit about the Better Care Fund plan and what it does. As I say, the focus is very much on preventing hospital admissions and care home admissions and facilitating hospital discharge. And in that regard, you'll see in paragraph 2.5 that the local plan is performing well, and our scorecard in particular shows that permanent admissions are under target. So that's something that we want to keep going. We're also pleased that we're being very successful with reablement and rehabilitation of people who are discharged from hospital. So that's a couple of highlights there. I mentioned that the focus of the fund has changed a little bit, and this started in September last year when the Minister announced additional funding for hospital discharge, and we came to you on the 7th of December last year for approval of a discharge plan. And that was then implemented, and that discharge fund is a core element of the Better Care Fund from this year and into next year. And the indicative figures are that we have around, excuse me, I'm just finding my figures, which are at paragraph 3.3, and you'll see there the Integrated Care Board's contribution to the discharge fund. So that's effectively new money this year is around about £1 million, and the local authorities' contribution is around getting towards £800,000. So that's money that we're investing particularly to focus on discharge and prevention of admissions. And with that comes a slight burden from NHS England in terms of reporting progress. We report fortnightly on the expenditure and performance of the discharge initiatives. But moving on to, we're also in this year not making significant changes to our plans. The pattern of services is broadly the same, and that's because we're undertaking a review of the Better Care Fund with the support of the LGA and NHS England colleagues. That will look at the alignment of the Better Care Fund locally to our strategy for adults, Better Care Together Thurrock. And we'll also have some deep dives into our arrangements for discharge using something called the high impact change model. So that will give us a benchmark on where we are in our performance nationally, but also ensure strong alignment with our local strategy. The nuts and bolts of this, as I said, suggest are a pooled fund. We have pooled the fund under Section 75 arrangement. So we have that pooled fund coming into place as soon as the plan is approved, and then we will be continuing with the administration of the fund for the rest of the year. Coming back to you, I think perhaps with the outcome of the review of the fund and any particular findings we have from that. So the requirement today is to ask the board to approve the Better Care Fund plan. That was in two elements. One is a narrative plan which really sets out what we're trying to achieve through the various schemes we're investing in, and then a rather detailed spreadsheet which shows exactly how the breakdown of funding is. And there's also an element in that spreadsheet which looks particularly at discharge and our capacity and our arrangements for targeting the fund. So again, the recommendation here, Chair, is for the board to approve the fund, approve the plan. The plan itself is with NHS and going through an assurance process, and we hope to have the completion of the assurance and approval of the local plan by early September, so a couple of months' time. Thank you.
Thank you, Christopher. I appreciate that. No, I'm assuming just to clarify, to go with for the legal implications of the report. Obviously, they're not included in, so perhaps this is something we'll go through before we go to vote. I understand. Have you got them?
Yes, I have them here. I can read them now if you like.
If that's right, then we can clear that. Make sure that's dotted.
Certainly, and we'll get those minutes as well. So the legal implications were verified by David Longy, Principal Solicitor, LBBD, on behalf of Thurrock Council, and they read: Section 75 of the NHS Act 2006 makes provision for joint partnerships between NHS and local authorities for the purpose of discharging prescribed functions for both statutory bodies. Particularly Section 75 subparagraph 2 makes provision for the establishment and maintenance of a fund which can be dispersed for the purposes of those prescribed functions. Pursuant to Section 75 of the Act and the Health and Social Care Act 2012, health and wellbeing's one of the functions of the health and wellbeing boards is to set strategic direction to improve health and wellbeing. The report sets out the work undertaken pursuant to the above mentioned legislative framework and is within the powers of the Health and Wellbeing and the Council to approve. And just to confirm, the Council and the Integrated Care Board for Mid and South Essex have already approved the plan.
Brilliant. Thank you, Christopher. I appreciate that. And before I go out to members, I'd just like to say that reading through the plan as, I'd say, a layman, very new to this, I'm sure many appreciate that, comparing it going through with Thurrock's care strategy and as we move forward, it was nice and refreshing to see how a lot of this is linking in and how we're actually looking. Our ambitions are quite clear of what we're trying to achieve. I think the takeaway thing, especially for me, of where we're looking, obviously the plan could evolve, especially with the consultation with the LGA, and be really interested to see, perhaps get an update, especially as once that consultation has happened, just to make sure that the board's fully aware, and be interested to see some of the work. And I really quite respect the work of our discharge teams after meeting them myself a couple of weeks ago. What they do is absolutely amazing work. So it's making sure we keep those numbers up and make sure we keep our performance going. So thank you. Is there any members of the board who wish to make any comments?
I guess I ought to comment. I think you've said most of what I would have said, Councillor Cockshaw. I'm particularly grateful to Christopher. I'd like to put that on record for the enormous amount of hard work that he's undertaken personally on behalf of us to get us to this point. I think this, this 2-year plan has the strongest narrative that I can remember in terms of the BCF. And you can really see a clear link and join through and join up between the BCF and the broader case for further change, better care together, Thurrock strategy. I think it's particularly pleasing that the metrics are good, particularly on hospital admission and discharge, because I think those are two really good system proxies for actually what we're trying to achieve, which is better outcomes for our residents in the community, and the prevention of demand and the prevention of failure demand. And the entire integrated care strategy has those, I think, two really key strategic aims running through it. So it's really good that's actually showing in the metrics as well. But I'm personally very happy to support this plan and thank all colleagues, because it really is a joint effort at Thurrock level. We are recognised, I think, as the alliance that is the furthest developed. That came up at the NHS England assurance meeting on Monday, which was again really nice to hear. And it's our collective partnership and our collective ambition and the way in which we work together to both develop that and then increasingly to implement that is clearly paying dividends. So thank you.
No. Thank you, Ian. Is any other member wish to speak? No. Well, we'll move to the recommendations then for the board to approve the Better Care Fund for 23 to 25. All those in favour? Agree? Agreed. Thank you very much. I thank you for bearing with us there. And I'd just like to make, just before we close the meeting, I'd just like to say that I have received, following communication from Jeff Banks, that they have received our letter of endorsement of the joint forward plan. And I've got the thanks from the Chief Executive, Anthony McKeever, and as well as Professor Mike Ford, the Chair of the ICP, who have said thanks for receiving the letter. So that's all gone ahead. So I'd like to take a moment to update the board on that. If there is no other items of business, then I propose that we close the meeting at 11:15. Thank you all for attending a relatively swift meeting, and I hope you enjoy the rest of your day.
Thank you very much. Bye-bye.
Bye. Thank you very much.